Hello, everyone. My name is Giulio Campanelli. If you are turning 65, new to Medicare, or perhaps you just want to refresh your memory about Medicare options, I put together a short video to help you understand the basics of Medicare. Welcome to Medicare 101. All right, this is what we are going to cover. We'll talk about original Medicare and its four parts. Your two choices. You have original Medicare or Medicare Advantage. What does Medicare cover? What is a Medicare supplement plan and how to compare them? What is a Medicare Advantage plan and how to compare them? Part D prescription drug plans and important enrollment dates. There are four parts to Medicare. Your Part A, which covers your hospital. Part B, which covers your medical, things such as your doctors, your specialists, and your outpatient surgeries, and things such as labs, of course. And then you have Part C of Medicare. That is when you transfer your Medicare benefits to a Medicare Advantage plan. So they work more like an HMO or a PPO. And then you have your Part D of Medicare, and that would cover your prescription drugs. All right, let's start with your first important enrollment date. This is when you first enter into a original Medicare. Your process would start 3 months before your 65th birthday, the month of, and it will continue for 3 months after. That will give you the time to enroll into Medicare Part B. Now, if you're already on Social Security, your enrollment into Part B is usually automatic. So you won't need to do anything. You'll just receive your Medicare cards in the mail 3 to 5 months before your birthday. Now, of course, we always, if you have not received your cards, we do advise that you check with Social Security to find out why you have not received your Medicare ID cards. Now, here are the costs associated with Medicare Part A. Now, most people are eligible for Part A when they first turn 65. Now, some people may have received Medicare earlier if they received it due to a disability. I am not going to get into that in this video, so if you do have questions about disability, please feel free to contact me. Thank you. Anyhow, Medicare Part A is at no cost to us as long as we have worked 10 years, 40 quarters, and have paid into the Medicare system. Now, Medicare Part A does allow you to go to any hospital that accepts Medicare nationwide. Now, the deductible is a little, just want you to know that it is a 60-day deductible, not a annual deductible. So when we're looking at the $1,484, that deductible is good for 60 days. So let me give an example. Let's say I went into the hospital on January 1st, and then I was released 5 days later, and then 10 days later, I went back into the hospital. So still in the month of January, I'm still within my 60 days. I do not have to meet another $1,484. Now, on the other hand, if I return back to the hospital later in the year, like as an example, I went back into the hospital in March, I would have to meet the $1,484 deductible a second time. Okay, so it's not an annual deductible, it is a 60-day deductible. Now, let's say you're in the hospital for more than 60 days, and now you have a long-term hospital stay. So as you can see here, days 61 through 90, you would owe $371 for each day. That would total $22,260. Now, in addition to that, if that turned into 150 days in the hospital, you would have an additional what's called a 60-day lifetime reserve. Now, for those days, you have $742 a day for each day that you are in. Okay, so in this scenario, if you were in the hospital for 150 days, you'd be looking at $68,264. Now, please, just to note here, this is being recorded in 2021. These rates or these charges do go up every year. So if you want to, if you're watching this video after 2021, you could go to medicare.gov to find out the new numbers. All right, thank you. Also, I just want to point out that Medicare has no out-of-pocket maximum or a cap. So to explain that a little bit, if you're looking at your insurance plan today, you'll notice it has what's called an out-of-pocket maximum. That out-of-pocket maximum might be around $7,000, $8,000 on your plan, on your insurance plan. And what that means is that if in any given year you have paid up to $8,000, you no longer have to pay any more out of your plan. Your plan now will cover you 100%. Medicare does not have an out-of-pocket maximum. Also, on your lifetime reserves, those 60-day lifetime reserves, you could only use them once. Once you've used them up, they will never be available again. All right, these are costs associated with Medicare Part B. For most people, they do become eligible at the age of 65, but you can delay your Part B if you continue working and you are on a creditable group plan. You may want to check with your employer to make sure that you qualify, that you do qualify and it is considered creditable coverage to delay your Part B. Premiums start at $148.50 per month. I just want to point out one more time that this video is being recorded in 2021. So if you are watching this and after the year 2021, those numbers may have changed. Now, also that number could be higher depending on your income. So if you have a higher income, you may be required to pay more for Medicare Part B. And also, if you have low income, you may qualify for Medi-Cal, which would pay that premium for you. I'm not going to get into Medi-Cal in this video either, but if you do have questions about low-income subsidies, please feel free once again to contact me. Thank you. Part B does work with any doctor facility that accepts Medicare nationwide. Now, let's talk a little bit about the deductible. The deductible for 2021 is $203. Once you have met the $203, after that, you would be responsible to pay 20% of your doctor visits, specialists, lab work, anything that falls into the Part B category. Also keep in mind that some doctors may charge an additional 15% above Medicare assignment. You would have to ask your doctors on whether or not they're going to charge that extra 15%. Once again, Medicare Part B also does not have a maximum out-of-pocket. So those costs can continue to rise if you have any major things such as cancer. It can become very costly. All right, so now that we have gone over the costs associated with the original Medicare, let's discuss ways that you can protect yourself from these out-of-pocket expenses. The first is a Medicare supplement. So also known as a Medigap plan. In order to enroll into a Medicare supplement, you must be enrolled in Medicare Part A and Part B. There is an additional premium to pay for a Medicare supplement, and that would be in addition to your Part B premium. Costs or premiums do vary by company, so it's always a good idea to shop around for your Medicare supplement, and premiums do increase as you get older. A drug plan is not included in a Medicare supplement. You do have a guaranteed issue onto your Medicare supplement. So when you first turn 65 or you first enroll into Medicare Part B, So in other words, if you were on a employer plan and didn't retire until you turned 67 and you delayed your Part B, you have 6 months after your Part B enrollment to choose a Medicare supplement plan without answering any health questions. Now, after those 6 months, insurers can ask health questions and can decline your application or charge a higher rate based on health. Please note that these rules may be different in some states, so I ask you to please check your state-specific guidelines on this. And if you have any questions, please feel free to email them to me. Now, a Medicare supplement does give you the freedom to go to any doctor or specialist or a hospital of your choice, or any of the hospitals that do accept Medicare, and that would be nationwide. So, example, you live in California and you want to go to see a doctor in New York, your supplement is going to travel with you everywhere you go, provided the doctor accepts Medicare. Coverage on a Medicare supplement, it's standardized coverage. So each supplement does have a different letter, A, B, C, D, F, G, K, L, M, N. Now, do not confuse these letters with your Medicare Part A, B, C, and D. These are letters that are also applied to your supplements. Now, once again, each company can charge a different rate for the same exact type of coverage. Also, a little note here, as of January 1st, 2020, Plan F and Plan C are not being offered to new Medicare beneficiaries. All right, this is a graph of Medicare supplements and all the letters that we just discussed. Again, not to get these confused with your Medicare Part A and B. So if we're looking at this graph, the most popular plans at the moment is Plan G followed by Plan N. Plan G, as you can see, covers 100% of the costs, which pretty much means the only thing you'd be responsible for, and by having a Plan G, would be the planned year's deductible. And at the moment for 2021, that's $201. Plan N would be the next popular plan. But as you could see, for this, you'd be responsible for Part B deductible and as well as the excess charges. If the doctor charges the additional 15%, then this would be your responsibility to pay that in a Plan N. I'll just let you look at this for another minute and then we'll move on to the next slide. Once again, I do want to remind you that Plan C and Plan F, once again, are no longer available for new Medicare recipients as of January 1st, 2020. If you're currently on a C or an F plan, you can remain on these plans, but I highly recommend reshopping them, as the rates on a Plan C and F are going up at a significant higher percentage than something like a Plan G or an N. Just want to point that out. You may want to reshop. All right, so now if you remain on original Medicare, your A, your B, and you have a supplement in place, you're also going to need a drug plan. Now, most prescription drug plans do also have an additional monthly premium and an annual deductible. The deductible is on a calendar year, so that means it starts every January 1st. And the plans use a formulary, so the list of individual drugs covered by the plan. Now, please note that some plans may not cover some of your drugs, so it's always a good idea to use the Medicare.gov tool or work with an agent that can help you find a drug plan. They do have different tiers. So basically tier 1, tier 2, tier 3, 4, some will go up to tier 6. A little bit about prior authorization and quantity limits. Some drugs do require you and your prescriber to contact the drug plan before you can fill certain prescriptions. So here's something I often get. I'll get a client saying, "Oh, my plan didn't cover this." Usually, it's just a block, and the plan needs to be called along with your doctor to make sure that it is a medically necessary drug. And sometimes it may be blocked on quantity limits. So certain opioid drugs might only allow a certain amount, which requires prior authorization. This is nothing to be alarmed about. It just means you have to go an extra step, which takes me to step therapy. Step therapy basically requires you to try a lower cost drug. So as an example, your doctor may have prescribed you an expensive brand name medication and there is a generic available. They might force you to try the generic before approving the brand name medication. All right, so now that we have talked about Medicare Supplement and Original Medicare, let's talk about a second way that you can protect your out-of-pocket expenses. That is a Medicare Advantage plan, which is also known as Part C. So Medicare benefits, basically your Medicare benefits are transferred to an insurance company, and the insurance company will manage your benefits for you. Some of these plans may require you to select a primary care physician and stay within a network. Also, some of these plans may require you to have a referral in order to see a specialist. These plans do come with 0 to low premiums. That would be in addition to your Part B, so you would still be responsible to pay your Part B premium. Now, your drug plan is included in most of these plans. So, in other words, these plans are typically like an HMO or a PPO that you might have through your employer, where your medical, your hospital, your doctors, and your prescription drugs is all embedded into one plan. In addition, these plans may have additional benefits that are not offered by Original Medicare, such as dental, vision, and hearing. All right, so now let's discuss a little bit about late enrollment penalties. I mean, I often run into people who are healthy and do not want to enroll in Part B or Part D. Of course, it's your right not to, but please note that you are penalized for not enrolling into Part B when you are entitled to it. So for each 12 months you are delayed enrollment in Medicare Part B, you will have to pay a 10% Part B premium penalty. Now, unless you have an insurance based on your or your spouse's current work plan, so a job-based insurance, or you are eligible for a Medicare savings program, also known as Medicaid. There's also a penalty for Part D, excuse me, if you don't enroll in Part D when you're first eligible. So if you decide not to join a drug plan when you're first eligible for Medicare and do not have any other creditable coverage in place, you will be penalized 1% for every month you are uninsured. I understand that some people don't want to join, but please note that you are penalized if you do not have other creditable coverage. All right, so this is the part where you decide the coverage that is going to work best for you. Again, let's just recap. You can stay on Original Medicare Part A and B. You can decide if you want to have a supplement, and you can decide if you want drug coverage. Again, if you do not sign up for your drug coverage when you are entitled and do not have any other creditable coverage in place, you can be penalized. Your other option again is a Medicare Advantage. You transfer your Medicare benefits to a Medicare Advantage plan. It works like an HMO or a PPO. Again, that is considered the Part C. It will combine your Part A, your Part B, and usually your Part D all into one plan. So why work with me? Well, the question should be, why not work with me? Just kidding. Anyhow, I have been licensed since 2005, and I am trained to understand how Medicare works. Every year, I spend over 80 hours obtaining certifications from over 15 insurance companies. In addition, every year, I must pass an AHIP exam, which is a Medicare exam every year that we have to pass. I am available to my clients all year round to answer any questions. Once again, I am contracted with over 15 insurance companies, so I have an unbiased opinion. My job is to help educate you on your options, your plan benefits, confirm that your doctors are covered, and help you choose a plan that will fit your budget. My service to my clients is always complimentary. I work solely on commission, and that is paid to me by insurance company. In addition, technology. 95% of our clients prefer to enroll online, so we have the technology to make that happen. So what is next? Note, Medicare is complex. We did go over the basics in this video, but I highly recommend that you work with an agent that understands all of your Medicare options. In addition, if you're watching this video on YouTube, I have provided links to valuable resources such as the official Medicare handbook called Medicare and You. I also provided a link to the official Medicare website, medicare.gov. That said, if you want a shortcut, I'm also here to answer all of your questions. My phone number is 424-257-3314. You can also, my email address is also there as well. I hope you found this video helpful. If you liked it, please click on the like button and feel free to share. Have an awesome day.